done by the federal government to solve this problem.
And I want to bring in Dr. Delgado-Borrego now. She is a pediatric gastroenterologist, perfect person to talk to about this. Doc, we appreciate you being here today. First, I do want to just get your reaction to this Operation Fly formula the government has put in place now. Should we be worrying at all about the safety of this formula that's being brought in from other countries?
I think it's, well, thank you for allowing me to speak here. I think that we need help, and that means that any measure taken to alleviate this problem is welcome. Having said that, I will say that what's very important for parents to understand is that most babies can certainly switch to different brands, even if they do not appear to like the formula, or, as one of the moms was mentioning, may have mild reflux at the beginning when switching brands. But overall, the vast majority of babies can switch brands. But what I cannot emphasize enough is the absolute need, the importance of parents talking to their physicians. So any usage of any significant change in formula or use of other types of formulas from abroad, or even from within the United States, but of a different type, should certainly be discussed with the physicians. There are also, I will say that there are also many infants that require very specialized formulas, and in particular, those babies really may have certain specific needs, such as what you mentioned, food allergies or other issues for which they require specialty formulas.
Yeah, we've been trying to gather the best advice for parents while they're dealing with what I think for a lot of families, this is a crisis for them. What do you recommend to parents who can't find formula and who are unable to breastfeed?
Yeah, excellent question. First and foremost, not to panic. Then I would say plan ahead. You mentioned here also milk banks, and I would say food banks. There are often many available food banks and milk banks that people typically are not aware of, but can find out from their local communities or their city resources. Certainly those are available. There are many patients that are able to obtain their milk supply from WIC, and that's also an excellent choice. So there are available resources. Sometimes the issue is that parents may not be aware. So not to panic, find the available resources. And last but most importantly is do not find alternative ways. So do not dilute your formulas. Do not try to make your own home-based formulas.
All right. Dr. Delgado-Borrego, we appreciate your time and expertise today. Thank you.
Thanks.
Happening now, President Biden is in Seoul, South Korea for his first trip there as commander-in-chief. This comes as the White House